The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here for another episode of TMD Demystified. I am Tony Urbanek. Today's topic is TMD, the most misunderstood disease on the planet. And that is my opinion, and I stick by it. The more I study it, the more I am convinced it is the most misunderstood disease on the planet. I have put 50 years into the treatment of TMD, temporomandibular joint disorder. As most of you know, I'm an oral and maxillofacial surgeon. What I'm finding out is that this podcast is viewed more and more by patients. Actually, it is viewed more by patients than it is by dentists. So I have been making a pivot to address this podcast and these episodes more toward patient knowledge. But I think that it is safe to say that educating patients may be more important than educating the dentist, because the dentists don't want to hear anything about TMD. We'll talk about that in a minute. A little frustrating when you put 50 years into studying a disease and end up with the opinion that it is the most misunderstood disease on the planet. So the other thing I wanted to clarify, and I've talked on before, I've noted before, that on top of a weekly podcast episode, I also do a blog weekly, which is a written blog, which can be seen, read on our website, www.urbaniktmj.com, urbaniktmj.com. And anyone who wants to follow along can go to that website and get a written copy of what I'm about ready to discuss. So what I'm going to do is I'm going to use that blog that I wrote last Sunday evening and include it in the presentation today, which hopefully will not confuse you, nor will I make it any longer because we're going to do this. But I put a lot of thought into the blog, written blog, and I would like to read that with you, and make comments as we go along as necessary. And again, it's entitled TMD, the most misunderstood disease on the planet. TMD, temporomandibular joint disorder, is a very common disease. 45% of females in the United States suffer from TMD symptoms. If you read the literature, which I have for 50 years about TMD, temporomandibular joint disorder, what you will read, depending on the country that the study is done in, and which university and how many people that are studied, you'll read that the incidence and prevalence of TMD is roughly between 15 and 30%. But what I also found out is that those studies never include all of the symptoms. They just usually include the very localized symptoms associated with pain in and around this joint, and facial pain, and different euphemisms, not necessarily diagnostic terms, but euphemisms like trigeminal neuralgia, which is just a catch-all phrase. Trigeminal neuralgia is a catch-all phrase and really cannot be defined well, if at all. It's a very old term. Prior to trigeminal neuralgia was tic douloureux. Trigeminal neuralgia, all it means is pain, neuralgia of the nerves associated with the trigeminal nerve, which is the fifth nerve that has four sections, one coming up here, one coming up here, and one coming to the mandible. Trigeminal neuralgia. But in itself, it is not a disease. It is description of where the pain is. So, not getting too deep into the weeds, when you include all of the types of symptoms associated with temporomandibular joint disorder, and it is only one disorder, it is not disorders. They like to make it disorders because they, meaning the academicians, and basically I was trained as an academician. I decided at the end of my academic training with degrees in not only medicine and dentistry and cell biology and anatomy, and 2 years as a fellow with the National Institute of Health doing research on facial growth and development, I was trained as a researcher. And the academicians actually are part of the problem because they have not studied the problem in depth. Going on. So the symptoms, when you add all of the symptoms associated with the problem, and the academicians like to just list the symptoms and say that it's a complicated because it has so many symptoms. We're going to get into that and why and how in a minute. But the actual prevalence, incidence of TMD is 45% of females. 45% of females have one or more of the temporomandibular joint symptoms, which are directly related to and caused by inflammation within the temporomandibular joint. That is the discovery that separates anything else, anyone else, any other study ever done, which defines the common denominator of the disease, creating all the symptoms. TMD should be classified as a medical disease because it is just like any other joint in the body. The temporomandibular joint is just like any other joint in the body. But it is treated by dentists. It is classified and should be classified as a medical problem, a medical disease. This joint is no different than any other joint in the body as to how it operates physiologically, pathologically, how it interfaces with the endocrine system, the nervous system. But dental schools claim that this joint is different. It's very unique, which is not true. The vast majority of dentists don't want to treat it. In fact, they don't want anything to do with it because they don't know how to treat it. They don't know how to diagnose it. They do know it is a very complicated disease because that is what they were taught in dental school, and that is true. I have never talked to a dentist, and I have talked to hundreds and hundreds and hundreds of dentists about this problem, and not one of them has ever disagreed that they were taught in dental school, whatever school they went to in the United States, that they were taught this joint is unique, it is complicated, it is unlike any other joint in the body, which really is the first lie. It is not true. The joint operates like any other joint in the body. I mean, if you just use common sense and logic, why would the entire body and all these other joints operate with the same pathology, with the same neuroendocrine system working in the same way, and somehow this joint was going to be different? Does not make any sense. 50% of dentists tell patients they don't treat it, and 49.99% make a night guard for the disease and hope the patient does not return because they know a night guard does not treat TMD. There are some dentists who actually believe a night guard treats TMD. A night guard meaning a piece of plastic, acrylic, that goes over the teeth. And the purpose of a night guard is nothing more, nothing less than to protect the teeth if you clench or grind the teeth while you are sleeping. That is, and it is a valid purpose to make a night guard if you want to protect the teeth. But a night guard has nothing to do with treating inflammation in this joint. In fact, very often it makes it worse. And we have majority of people come in who have been given a night guard and said it just makes it worse. Why? Because it just gives them something else to chew on between their teeth. And they'll fracture the night guards and they'll chew through the night guards all the time. But a night guard is valid for protecting the teeth if you clench or grind, but doesn't do anything to decrease inflammation within the temporomandibular joint. Then there are 0.01% of dentists I call TMD gurus who try to treat the disease using smoke and mirrors and game the medical insurance companies to pay for their nonsense treatment. This is a fact, and I stick by it. Doesn't give some dentists a good point of view. It doesn't put them in very good light, but that is what I have observed over the past 50 years. First, treating temporomandibular joint for 36 years as an oral maxillofacial surgeon, doing over 2,000 temporomandibular joints cases, 2,000 hospital operating room cases on the temporomandibular joint, half of them through an arthroscope and half of them open joint surgery and making an incision in front of the ear. But I had to observe the entire time my colleagues, my dental colleagues, who were classified as TMD gurus, hooking up the patients up to machines and doing all kind of things, and then applying for medical insurance to pay for it. Again, TMD is a medical problem, just like knee inflammation and damage, hip inflammation and damage. Elbow inflammation and damage is a medical issue. It is not covered by dental insurance ever. You're not going to have a knee inflammation and bone loss and damage covered by dental. Well, why would this particular joint be covered by dental insurance? It isn't, but it isn't covered by medical insurance either, because the medical insurance patients don't want anything to do with it because the dental schools teach it's unique and different and unlike any other joint in the body. It's circular. It just goes round and round in circles. The most recent example that I can think of is the use of botulinum toxin A, better known as Botox, injected into the symptomatic areas, paralyzing the muscles and relieving pain because the muscles no longer work at all. A recent scientific study published in the January issue of the Journal of Oral and Maxillofacial Surgery has statistically proved, that injecting botulinum toxin A and saline into the facial muscles, particularly this big muscle right here is what the study was on. It's called the masseter muscle. Injecting botulinum toxin A, Botox, into this muscle and saline into this muscle gives the same result. Tells you what Botox is all about. But there is an increasing large cadre of dentists who promote the use of Botox because they are sold on the concept that it fixes the problem by Botox salesmen and advertising literature. They admit the biggest advantage of Botox is the patient must return for further Botox injections every 3 to 4 months. I actually have a patient who swore to me, and she said, I can bring in the receipts from the Botox injections that I and my insurance company have spent over $200,000 on Botox injections over 10 years. It was 10 years, $200,000 over 10 years. That's $20,000 a year. And that is what she said. And she said, I can bring on the results. And she was sitting in my office with the initial symptoms she started with the Botox. Proves the point. Amazing, just amazing. What they don't want the patient to know is botulinum toxin A, Botox, is not approved by the FDA to treat TMD. And that dentists or anyone else who is using this to treat TMD symptoms is using it off-label. That is a fact. No one's going to disagree with me on that because it's not approved by the FDA. It is approved by the FDA to remove and help with wrinkles if you want it to. So, number one, there's a lot of nonsense going on, and anybody who has this problem for any length of time is, number one, run around in circles with their providers and eventually come to their conclusion, that there isn't a solution. Nothing works. There isn't a solution. That's the story on dentists. Physicians, on the other hand, don't want to do anything with TMD for the same reasons as dentists. Physicians know they don't know anything about TMD. Problems with the temporomandibular joint are not addressed anywhere in medical school or specialty training. If a medical doctor suspects their patient has TMD, he will tell them, see a dentist. Both dentists and physicians agree on one point. The consensus is, when it comes to treating TMD, nothing works. Again, I have talked to hundreds and hundreds and hundreds of dentists about this, and the vast majority of them, excepting for the TMD gurus using smoke and mirrors, agree that nothing works. The most prominent complaint is they don't want anything to do with TMD patients because whatever they try to do, they know the patient will always be back coming back to the office time and time again with the same symptoms, not knowing what to do about it.